Good day everyone, I am Joanna Merderan, a second year student of Davao Doctors College, and today I am going to perform a third demonstration of a basic life support for adult and pediatric patients, plus AAD skills. Basic life support is an emergency management provided by the first responders, healthcare providers, and public safety personnel to people who are experiencing cardiac arrest and respiratory distress. And we will going to use three materials on this return demonstration. First, we're going to use the AED. Second is the suction. So begin with the assessment and activation. So I arrive in the scene and I see the patient is unconscious or appears to be unconscious. So scan the area or check the environment for any hazard present. A hazard could be a fire, falling debris, chemical, or just anything that could potentially harm us. Because if there is a hazard present and if we do get injured, we will therefore be unable to help and assist the patient. And now, some safety would also include as of personal equipment such as a gloves and pocket face mask, which I will be using for later for performing the CPR, because this face mask will make the CPR much safer for the rescuer, as it reduces the risk of the contamination. So now check safety would also check the level of the victim's unconscious and irresponsive by tapping the patient's shoulder and asking if he's okay. Shout at his ears like, hey sir, hey sir, can you hear me? Are you okay? And now also assess whether the patient is he breathing normally, is in an agonal respiration, or just breathing at all. So patient has no movement and has no response, and he's not breathing. So activate the emergency response system as bystander to call 911 immediately. User of black shirt, call 911. We have a patient here. We need help. And now turn back the patient and check the patient's pulse and breathing again. If the patient is not wearing constricted clothing, we will loosen it up. So check the patient's mouth as well to see if there are anything that is in there that causes an obstruction of the airway. So checks the patient's pulse and breathing, like 1001, 1002, 1003, 1004, 1005, 1006. And now patient has no pulse and not breathing and is unconscious. Proceed now to performing CPR. So deliver high quality chest compression. First, locate the chest area of the patient and place the hand of the top of the center of the patient's sternum now, and interlock fingers. And then lean over the patient's body and have you elbows locked straight. So start doing 30 chest compression at a depth of 2 inches, like 1 to 30. And now ensure that there are complete chest recoil for each compression. And after doing the chest compression, immediately administer two rescue breaths in patient. So I'm gonna do the CPR now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So after doing the chest compression, immediately administer the two rescue breaths for the patient and use bag mask or barrier device cover the patient's mouth and nose with it. So head tilt and chin lift open the patient's airway and then deliver the rescue breaths. So each rescue breath should be given over a second, and 3 should be visible chest rise for each. 1, 2. So continue doing the chest compression and then proceed to the rescue breaths again until the AED arrives or until an emergency responder arrives to take over. So proceed with the AED skills until the AED arrives. Continue during the chest compression and the rescue breaths until the AED is ready to analyze. Now, assuming that I am the second responder, turn on the AED. So quickly scan the patient's chest. If the patient's chest is hairy, you will have to quickly trim the areas to which the punches of the AED will go, because hair will act as a barrier, and then the AED might not be able to deliver the greatest shot. So place the patches. One will go over the upper right area of the chest, just below the clavicle, and the other one will be placed beneath the patient's armpit, just below the nipple. So the AED will start analyzing the heart's rhythm, and it might tell us to stop during the compression and rescue breaths as it is analyzing. So it will have to deliver electric shock. So make sure to clear the surroundings. Everybody clear the deliver and shock in 1, 2, 3 shock and delivered. So after AED will tell us to resume the 30 chest and rescue breaths for how many cycles. The AED will analyze again the patient's heart rhythm, and if necessary still it will deliver an electric shock continues until the AED tells us to stop, or until the patient has already been revived. So now document the procedure done and the time and the resuscitation started up until the time it ended.